Hello, let's do our anytime yoga for the day. And today we're going to start at the top of our body with our head and especially focusing on the neck and the movements between the head and the neck. Thinking about the top two bones of your spinal cord, which are known as the axis and the atlas. These two bones are pivotal with assisting your skull in its movement, and there's loads of potential for movement for the skull, the head. So we're going to start by looking at that and practicing the simple movements to keep it so that it moves freely and flows, and that there's no stress or tension building up, especially in the neck. So you might like to do this with a wall behind you to keep your spine nice and straight. Get your buttocks as close into the base of the wall as you can, and then have this lovely connection of your spinal cord all the way up the wall. And to begin with, just rest the back of the skull on the wall as well. And then you can either have your hands resting by your hips or just place them on your thighs. You might like to close your eyes whilst you practice this, because that could help you get a real deeper inner view. And using the powers of visualization, you could picture those top two bones of the spine, the axis and the atlas. And you can picture the way the skull sits into them at the very top bone, with this little nodule and the base of the skull just sitting on top, which will allow it to move forward, backwards, rotate round, and then tip laterally. Okay, so we're going to actually look at that in a practical, from a practical experience now. Just take a moment or two, however, to connect with the breath, because of course the breath is going to help. Breath equals movement, movement equals breath. They are one and the same. So tune into your flow of breath and become aware that as soon as you start observing the breath, it begins to lengthen and deepen. And this in itself is beneficial, because nice, long, slow, deep breaths bring about a sense of calm. It's very soothing to the nervous system and that deeper parasympathetic nervous system. Notice how the inhalation will bring a sense of lift and elevation, rising upwards, and then when you exhale, it's a relaxation, it's a surrender, it's a release. So now you've had time to tune into the breath, take your mind into the top two bones of your spinal cord, axis and atlas. Take your mind too into your skull and become aware of how it sits at the very top of your spinal cord. You're going to take a breath in and think about lifting the skull just up away from those two pivotal bones. And then as you breathe out, allow the chin to drop down towards your chest. Breathe in and bring the head upright. Another breath in and create space, have a little bit of lift once again, and then as you breathe out, Let's turn the head to the right. And if you've got your eyes closed, really view how your skull is turning. And then breathe in, coming back to neutral, centre. We're going to go to the left. Just check that you've got a nice relaxed jawline and your teeth are unclenched. Sometimes through concentration we will tend to grit the teeth and bite them together, and this creates tension unnecessarily. We want everything to be nice and soft and relaxed during the movement. Another breath in, and then turn the skull to the left. Only taking it as far as it feels comfortable. If you face any blockages en route where it feels really stiff, or you've got tension in your shoulders, then just go to the point where it feels comfortable, tune into your breathing and start to unravel the tense parts. It will take time, and it will be on the outbound breath, the surrendering breath, the relaxing breath, that it will take place. So be patient. And if you stay tuned in, you will actually experience the releasing of the tension so that you can then make further movements. And when you can take the head to its fullest potential of movement, at the moment we're on the left side, just check also that you have this sense of your chin being parallel to the shoulder, that you're not actually raising the head up too much or dropping it down at the moment. You want to keep a nice alignment, and then come back to a central position. Another breath in. Again, think of creating that little lift so that you're lifting the skull away from your spinal cord, and then drop the head over to the right. Again, getting some alignment here. And it might be that if you have a mirror in front of you, you'll be able to see if you're aligned, because you might be twisting the head up too far as you drop it over. You might be dropping it down. You really want to have it so that the ear is coming down on a nice arc, a nice curve in line with your shoulder. And then breathe into the center. Exhale to the other side. And then breathe into the center. And then just gently move yourself forward away from the wall slightly. Take another breath in, create space. And then exhale. Drop the head back. And then return to a central position. We're going to go again with dropping the head back. This time we're going to use the bottom jaw to open and close, which in itself will help tone the skin on the neck and around the chin. So take a breath in, make lots of space, and then exhale, drop the head back. Once the head is back in its fullest position, release the bottom set of teeth and allow the mouth to open. And then breathe in, bring the bottom set of teeth up. Exhale, release. Breathe in, bring the bottom set of teeth up, so you're actually bringing a bit of a clench to the jaw there. And then when you exhale, relax. And do this a few times, however many times feels good for you. And then come back to a central position. And if you practice that one quite regularly, hopefully it's intended to keep away the double chin and to just keep some tone around the chin and the neck and the throat. So now if you just bring yourself a little bit away from the wall, we're going to do a full circular movement of the head. So again, you might like to close the eyes so that you can have that very personal experience of perhaps using your visuals to see your skull sitting on the top of your spinal cord. And if you have difficulties in visualizing this, then just look at a diagram first. Get an idea of what you look like without your hair and your skin and just your bone. So you're looking at your skull sitting on the top of your spinal cord. Those top two bones, axis and atlas, atlas and axis, they both work together. C1 and C2 to attach your skull and give it great potential for movement. So let's begin doing circular movements with the head. So take a nice breath in and create space. Feel that you're lifting your skull just up away from those top two bones, and then let's make circles with the head. Now it may help to tune into the tip of your nose and see it possibly as a pencil tip, and you are drawing a circle. Now you can start with a very small circle, and then you can get bigger and bigger. Try moving nice and slowly so that the move is graceful and it flows. There's no jerking or sticking. It's just one big circular movement, really freeing up full potential mobility in your head and neck, and keep checking in on the shoulders, that you've not brought them up to your ears with tension. Keep the shoulders soft. Come back to a neutral position and then go in the opposite direction. Again, using the tip of your nose as a pencil tip. And return to the center. So it's really useful, beneficial to give your head a little bit of a workout, and it's very simple techniques, but it will keep a nice flow of rich oxygenated blood, and it will keep the bones mobile. So it's something worth doing whenever you remember to. Anytime yoga, it can be practiced at any time and anywhere. Another quick technique as well for stressed out shoulders is to take a breath in and bring the shoulders right up to your ears, and then exhale, relax them down. And again, breathe in, breathe out. Third time, breathe in, breathe out. Another quick technique, continuing around the upper body, within the shoulders, for this modern life where we're a bit sedentary, or we find ourselves at a desk a hell of a lot, and we tend to really hunch over and collapse down in our abdominals. So we want to reverse that learning conditioning that we've done to the mind and the body. And very simply, what we're going to do is do what's known as the jackknife arms. Now, this may not be comfortable to begin with. Do take your time And you can start with a belt or strap between the hands, first of all, if you're unable to get the fingers to link when the hands are behind you. So if you turn sideways on, or at least have the wall away from you so that you can get your arms behind you, you're going to take the hands behind and link the fingers. Now, before you get to that point, you can work on just even opening across the chest, drawing the shoulders back, drawing the shoulder blades towards each other. Even this, small pulses. Get yourself opening up, preparing to take the arms into the full position. You can go back to a couple of days ago when we worked on rotating the arms fully from the shoulder girdle. So you could do some of that, rotating them on both sides, and then bring the fingers to link. And then on an exhalation, you'll extend them behind you. Again, this may not happen immediately. Use a belt or a strap. If you've got a bit of a bend in the arms to begin with, that's fine. You've got to work, you've got to start from somewhere. And even from this bent position, it will be every time that you breathe out that you'll be able to just release and let go of all that built up tension and stiffness and rigidity in the bones. Be patient with yourself. Persevere. Unclench your teeth. Follow the flow of your breath. And then nice and gently come out of the position and unclench the fingers. Have a breath in and out. And then we can go again, but this time you'll change the grip of the fingers. The mind gets so set in its ways, and you'll always tend to go for the position that you would just naturally go for. So it might be that you always, if you're told to link your fingers, you would always put your left finger on top. So this time, swap it over and put the opposite finger on top. And it will feel a bit strange. If it feels a bit strange, it means you're doing it right. If it feels just the same, check. You've probably gone to exactly the same link that you would always naturally do. That's one of the best things about yoga, is that it just keeps your mind active and alert. It makes you think a hell of a lot. So go the opposite way, again doing that rotating of the arms fully at the shoulder girdle, so you can get both the arms and the hands behind you. Relink those fingers. Take a nice breath in and rise up, lift up, create space in the torso. Lift your stomach, and then as you begin to exhale, you'll straighten the arms. Now this position does pull some tension into the muscles of the upper back and in the shoulders, but that will dissipate and release quicker, faster, deeper as soon as you let go. And avoid crashing out of the position and really just releasing too fast. You want to take your time and release nice and slowly. And give the shoulders a little roll back and forward. And then bring yourself back to sit against the wall. Just have your hands resting on your knees. Get the back of your skull resting against the wall. Close the eyes. And be aware how you feel, both internally and externally. Simple techniques for anytime yoga. Start bringing them into your everyday, and you will notice changes. You'll experience a softening of all those years of rigidity. And do it now, do it immediately, and continue doing it through your life, so that when you become an OAP, you'll still be as fit as a fiddle, supple, flexible, and kicking your heels up. I'll see you tomorrow.